I'm Dr. Christina, and I'm here at Walter Hall Park today in Southeast Houston to tell you about running drills you can do even here in a park to make your running better. So first off, I want to talk to you about why do runners commonly get injured? Like, what is the reason that runners get injured? And most often it is because with running, most of the movement takes place in what we call the sagittal plane of motion. So if we were to divide your body from right to left, then that would be the sagittal plane. And when you're moving your legs forward in this motion, that is in the sagittal plane of movement, all right? Versus the frontal plane, which would be if I divided your body in half from front to back, okay, so side to side movements are going to be in the frontal plane of motion. Now, you can imagine with running, that's going to take place mostly in this sagittal plane of motion, not a whole lot of frontal plane movement, which is fine, right? That's how it should be. However, a lot of people then neglect strengthening of the muscles in this side to side plane. And so when they run, we end up with people landing with their hip dropping to the side, which then can lead to the knee falling in towards the center, which can lead to the foot falling to the outside, or someone compensating for that and trying to overarch and land this way, which can lead to ankle sprains, can lead to the knee being strained on the outside and a lot of pain on the outside of the knee, and lead to a lot of tension building in the pelvic floor. So for runners, we want to make sure that we are doing exercises, drills to practice using frontal plane stability with sagittal plane motions, okay? And I'll show you what I mean by that. We're gonna go over 3 drills today that are meant to help you become a better runner, prevent injury in the future by strengthening and stabilizing in this side-to-side plane as you move in this forward-back plane, okay? So the first exercise is gonna be called hip hikes. To do a hip hike, you can do it standing free and having your foot popped up, but I find that a lot of people struggle with not putting weight on that popped up foot. So we're gonna do this against a tree, all right? So standing here against my tree, using this for balance, I'm gonna put all my weight onto what is my right leg, all right? And for a hip hike, we're gonna imagine that when I ran, my hip fell out to the side as I landed, and we want to counterbalance that. We want to strengthen against that. So for a hip hike, we're going to actually let that hip pop out to the side, and what I'll tell my patients is pretend like you got some attitude, all right? And then you're going to grow up and engage your gluteal muscle here, your gluteus medius and minimus to be exact, and pull that hip underneath you, okay? So no weight on this leg, all right? All the motion is happening in this frontal plane of motion, okay? And we're not gonna let anything happen in this sagittal plane. So things that you're going to avoid, all right? I do not want to see you doing any kind of straightening your knee, and that's how you get this done, okay? That knee should stay stable as you do that side-to-side motion. That knee is not going to move up or down, backwards or forwards. It is still in space, okay? I'm using this muscle here, all right? I also do not want to see your ankle rolling in or out to help you with this. So as you drop out, I don't want to see that ankle drop in. As you're pulling up, I don't want to see you roll out, okay? You want to keep your foot planted with your toes spread as you do this motion. So the only muscle that you are possibly using is your gluteus medius and your gluteus minimus, all right? We could dive further into this and about how you want to make sure that your pelvis is rotated and neutral. We could talk about how you want to engage your core, but really that's going to be on a more personalized level for each person to what level you need to do that, all right? You really shouldn't have to do too many of these before you feel the burn right in here, all right? If you're feeling anything in your back, if you're feeling anything in the outside of your leg, if you're feeling anything in the front of your leg, then you are not doing it correctly, all right? We want to feel all of that work taking place right in here, all right? So that's our hip hike, and that's going to help us avoid what we call hip drop whenever you land. Instead, as you land, you'll keep that muscle engaged and keep everything moving forward with stability in this plane of motion, okay? The next exercise we're going to talk about is your incline knee drives, okay? So we do want to make sure that we are stable in these outside muscles, but we also want to make sure that we're using more of our posterior chain to do running and less of our anterior chain to do running, okay? Far too many people automatically overuse their quadricep muscles, their hip flexor muscles as they're running, and you will see that they're pushing off with their quads and they're pulling through with their hip flexors rather than using the core to help and rather than using the posterior chain to push you forward, okay? So we're gonna go over a drill that would help teach you how to use your posterior chain over your anterior chain, all right? Using the tree again, or if you happen to be home, you can use a wall, a counter, either is fine, all right? You're gonna start with one leg back and one leg forward in a lunge position. Now, the muscle that you're getting the work in is gonna be this front leg, the posterior chain of this front leg, okay? So this one's not really doing any work at all if you're using this exercise specifically to target your posterior chain, all right? So we're gonna make sure we've got enough room that when I incline forward, when I drive my knee forward, I'm not gonna drive my knee into the tree or into the wall, all right? I don't wanna hurt my other knee. So in order to move forward, I am not going to overuse my quad to come forward. I'm not gonna straighten my knee. I'm not gonna arch my back to pull myself forward as I do that. What I am gonna do, okay, is engage that posterior chain. Squeeze my bottom, push my hip up and forward and drive that knee up as I do so. This simulates that running motion of pushing off and engaging that posterior chain to pull you forward rather than overusing those quadricep muscles, okay? So we would do this for both sides, and we would do this as a warm-up prior to running to kind of wake up those muscles and say, hey, you're about to work, so get ready and don't let the front muscles take over, all right? If you are running and you start to notice that you're getting less of a connection to your posterior chain, I'm not feeling it anymore, Christina, I'm not feeling the muscle engagement like you told me I should, you can pause, you can find a place where you can do a few of these incline knee drives, reawake those muscles and say, hey, wake back up because I need to use you, okay? And that's going to prevent injuries in the front of your knees. Lots of people who complain of anterior front knee pain after running is caused by overuse of those quadricep muscles. Lots of people who complain of my hip flexors are tight is because of overuse of those hip flexor muscles and not using the posterior chain enough. So this is a great drill to help with injury prevention and help you to be faster. Last exercise that we're gonna go over is a dynamic lunge exercise, okay? So we're gonna build off of that incline knee drive that we just did because we're gonna use the exact same muscles that we just used for that incline knee drive, all right? So to do this dynamic lunge, we're gonna start off with stepping 1 foot forward, 1 foot back. We're gonna lower that back knee down, bring ourselves straight down, and I'm gonna open up my glute of this front leg by sitting back. I'm not going to lunge forward as I see a lot of people do. I'm gonna lunge with that knee going straight down and this femur sliding back so everything is 90-90 right here, okay? Then to come up, same as the incline knee drive, I'm going to engage that posterior chain here in this front leg and squeeze that bottom to come forward and go to the next lunge. Bend this back knee, open this glute, slide that femur back, engage this posterior chain to come up and forward, okay? What I'm not gonna do that I see a lot of people do as they're doing their lunges is one, I already mentioned, we're not gonna go forward with the lunge because then you're telling me my knee hurts in the front, but as I do the lunge every time, I'm driving my knee forward, okay? I'm also not going to overuse my quadricep muscles because that's going to feed back into my habit of overusing those muscles. I'm instead going to continue to use my posterior chain. So I'm not going to push off with that knee straight as I'm going forward. Instead, I'm gonna make sure and use that posterior chain to drive my hip up and forward as my knee stays still in space, okay? So with your dynamic lunges, that's another great exercise to use either to warm up prior to running, or it's a great exercise to use when you are in the middle of running and you've lost your connection to that posterior chain. I do it all the time. I pause, I start doing a few lunges, wake up those muscles, and then I can take off again using the right muscles, okay? If you find that using these drills before you run does not solve your issues of knee pain in the front, knee pain on the outside, hip pain on the outside, back pain, any of those issues with running, if you find that these drills alone do not help you, go see a neuromuscular expert, which is your local physical therapist. We can make sure that you're doing these exercises exactly right, all right? Because even though I try to explain as much as I can about what not to do, it can still be difficult to learn to use your body differently when you don't have someone else instructing you. So go see your local neuromuscular expert, your physical therapist, and talk to them about, hey, I've tried these exercises. Can you watch me do them? Let's get better at these because I'd like to reduce my pain while running. And then they can also do any hands-on treatment that maybe you're lacking and can't get from just doing these exercises alone. So remember, I'm Dr. Christina. I love to share free information about this, especially with runners, because I am a runner myself. I feel like I have an unfair advantage over other runners where I can decrease my injury risk by changing my mechanics, by knowing the proper warm-ups, by knowing the proper cooldowns, and I want to share that information with you. So if you feel this is helpful, please like, subscribe, and share these posts so that way your friends can benefit as well, and we can make sure that we all get to run for as long as we want and aren't held back by poor body mechanics.